we're doing a huge disservice to people who are living with this disease. And eventually, you have caregivers who are burning out. It's an enormous economic cost. It's costing us billions in the health system, both directly but also indirectly.
Welcome back to another episode of The Leader Within. Today, I'm excited to introduce Dr. Saskia Sivananthan. She's an internationally recognized strategy and policy advisor on dementia care, is a co-founder and CEO of the Brainwell Institute, which is a non-profit dementia policy think tank. She's also an affiliate professor at McGill University and health data scientist. Given her experience, I'm excited to have her share her insights with you. Well, welcome, Saskia. Can you share with us a story that has shaped the trajectory of your journey or success?
Well, thank you for having me, Angela. First of all, it's a pleasure to be here. There have been, I think, several stories along the journey, but there was one in particular that really shifted my entire career trajectory. So I'd always been fascinated by the brain, and I knew that neuroscience was the space that I wanted to be in, mainly because I was a very curious child. And so research and science seemed like the perfect avenue for exploring and being rewarded for that curiosity. But when I was doing my grad studies in Montreal at the time, I actually was looking for an apartment and found the perfect apartment. It was this gorgeous hardwood floors that would never have been able to afford as a grad student. And it was in a rent-controlled building. It turns out that it was a seniors building. And they had just opened it up to the broader public. So I was like one of the first people under the age of 65 in there. And my neighbor, Vince, became a really close friend of mine. And he was older. He was actually not that much older, only about 68, but living with mild cognitive impairment, which later progressed to early stages of dementia, but also had other chronic conditions that he was trying to manage. And I think through the process of A, becoming his friend, and B, he also supported me. He would kind of keep an eye out for when I was coming home from the lab after 12 hours, and he'd have sometimes get food delivered to me. But in a way, I became his proxy caregiver, even though I would probably never have identified myself as that at the time. And through him, saw through his eyes how he interacted with the health system and the really big gaps in the system for supporting someone like him who lived alone, who didn't have any family, and had all of these multiple health concerns. And while I had been studying to be a neuroscientist, and I did complete that, I decided afterwards to go back to school and sort of change the entire trajectory to become and to learn more about health policy development and health data and how to support systems change. So I would credit Vince as really the reason for why the trajectory of my career changed. To also add that it was a very sad story for me. It still is. One Christmas, I was visiting my family in Vancouver, and during that time, he used to call 911 whenever things would get really bad. They would take him to different emergency rooms across the country. And during that Christmas, he had called someone but had slipped into a coma, and they had taken him to the hospital, and he never recovered. He passed away alone in a hospital bed, and they had no one to alert. So I didn't even know, because I'm not technically family. I was never called as his next of kin. And I didn't find out until I got back from vacation. I would call him. He never answered, didn't know what had happened. And I think it really put a face to how our system is just sometimes not set up to support people who have multiple chronic diseases, who are older adults, and who don't have someone to advocate for them as they move through the health system, especially if they have dementia.
Well, first of all, I'm so sorry for your loss. And it sounds like you had a very beautiful friendship with Vince. And I'm going to put a pin in that system piece of it and come back to that after with you. And I want to dive a little bit into just the piece of the caregiver, the friend. I think sometimes we underestimate as an employer, as a leader, or whatever it may be, how much that takes a toll on an individual, right? So as you were building your friendship and deepening that, how did you kind of navigate, this is hard to experience with him, but at the same time, see the beauties and learn from his experiences and really hang on to that piece as you just don't know what's going to happen next.
Yeah, absolutely. And I think also it had really shown me that as an employer, and when you manage large teams, it's sometimes easy to really get lost in focusing on what's the outcome that we're trying to achieve as a team, what are the milestones for the year. But we are humans. We are humans working towards these productive outcomes. But the humanity and the stories of those folks play such an important role in what they bring to the table, the strengths and the weaknesses, and collectively how we reach those outcomes. So I tried to, when I would have team meetings, always reflect on also what are people going through personally. I worked at the World Health Organization and Alzheimer's Society of Canada before this, and in both cases, I worked with these wonderful colleagues and team members who were also caregivers who also had their own health issues that they were dealing with. But those really were often a key strength that they would bring and a perspective that they brought that hugely influenced the direction in a very positive way of the kinds of work that we ended up doing. So, for example, at the Alzheimer's Society, we used to get phone calls from people from the public who were looking for information and looking for supports, really looking for supports. And that was not technically the role of the Alzheimer's Society of Canada. There we have provincial partners whom we work with who would provide that support, but we recognized that people were looking for that early triaging, that early education, and really the empathetic year. And then we would be able to support them by passing them on to our colleagues who would provide the more deeper programming and counseling support. And it was actually through team discussions where we had team members who reflected on, as caregivers, when they needed supports, where had they gone, how they had had a complete lack of educational support. And that was often what they needed first, or reflected on the fact that sometimes you just needed someone else who could be with you and listen first, and then be able to support the other outcomes that you needed. And that was ultimately how we shaped and developed a helpline at the Alzheimer's Society that could do that first intake of listening, of education that was very practical, that could then support that person as they went along on their journey to whatever other programming supports they needed. So that strength has been crucial when working with all of the different teams that I've worked on, whether it's international, national, or local.
What an incredible thing, because if you think about folks who are coming to you as a first point of contact, whether it be referral or just like you popped up on Google, and they are probably just distraught, right? Trying to figure out like what's next. Like there's so many things are on their mind. So the fact that you didn't say, that's not my business, you got to go figure it out yourself, and you utilize that opportunity to actually help, I think is the beginning of the systemic changes that are required to really support folks through that. And so there's that piece of listening to others, and then there's a piece of listening to yourself as a leader. So I'm curious, as you continue to navigate some of the gray areas, whether it's in business, academics, or whatever it may be, what do you do to effectively lead the leader within?
I mean, I've read a lot of different books and met a lot of wonderful mentors along the way who have really supported the evolution of my thinking as a leader. And I don't necessarily subscribe to one way or the other, but a type of philosophy that I do appreciate more is the idea of a servant leader. But but I really would meld that more to be around, again, you're taking the approach that you have hired people who are competent, who have skill sets that you value. So I have areas that I know I have weaknesses in, and my teams are there to enhance and support that. And so I often have to sit and acknowledge with myself, okay, this is not necessarily a strength, but I know that there is a strength that another team member might have that I can lean on, and it's okay to lean on those things. You can still be a leader and lean on teams and collaborate and work with them, and vice versa, because it's always by example. I am a bit of a perfectionist and a type A, so I have to remind myself that it's okay to fail. The failure was one thing that I really had to embrace. It was a difficult thing for me to do, recognizing that through failure is really stepping stones to learning. and a lot of forgiveness for yourself as a leader. I think people and teams have often, team members have told me that they've appreciated that I could admit that I'm wrong, that I can, and that I learn to empathize with myself, because it's only by forgiving myself that I can forgive others. And those are important pieces for being able to lead. In addition to all of the other aspects of learning from mentors, knowing what you don't know, and then trying to figure out what those are, being comfortable in the gray, that there's never going to be these clear-cut examples. As wonderful as KPIs are, and like, here's what the outcomes you're trying to hit, these are systems created by people for people. And I think I try to keep that at the forefront of my mind in any of the leadership work I do as well.
Okay, so you touched on something that I really resonate with, which is I'm also very type A. I love plans and all that other stuff. And I really struggle with failure. Like, I know it's part of the process. So logically, makes a lot of sense. But to actually put it in practice, now that's something else. So do you have like little brain exercises or whatever it is that you're like, you know what, this is how I'm going to continue to flex that muscle so I get more and more comfortable? Or are you just like, nah, I just dive in and I figure it out?
Sometimes a bit of both, but the planner in me likes to play out what I call the worst case scenario. So I'll think through something that is giving me some fear or anxiety, or something where I can see or am worried that it's going to be failure. And I play out the worst possible scenarios that can happen with those. Worst case. And then once you play that entire scenario out end to end, you really start recognizing that you can live with those scenarios. For the most part, the things that I'm not doing are not life and death. And so I can live with what that end scenario might be. And almost always there is an opportunity to remedy along the way. And so that's one of the ways that I try to lean into it. The other way is that I also say, okay, I have a 7-year-old son who also doesn't like failure. If I'm going to teach him how to fail, I've got to teach myself and do it in the process. And so the way I try to reframe it is, instead of looking at it as failure, I look at it as what is something that I have tried that I might not have been good at, but that I have given it a try. And then through that experience, it is ultimately still failure, but trying to frame that for myself and saying, well, look, you tried it, you failed at it, but that was part of the process of how you got to this end goal. And there's so many examples in my career where I have failed, but the failure was what actually allowed me to be able to have gotten to a point that I would never have seen. And I'll give you an example of that, because I find sometimes it's really helpful to talk through it more tangibly. After finishing up my graduate studies, I had done work that was really about trying to answer a problem that the Ministry of Health in BC at the time was dealing with. So it was a really practical solution through my thesis work. And through that, I learned how slow the process is, how systems are very difficult to change. And I thought, oh my God, is this like really where I want to dedicate my career? And at the time, I was offered a job in Alberta. And a lot of colleagues told me actually not to move to Alberta to take on that role for a variety of different reasons. They had experienced it themselves. There had been quite a significant changeover in the Albertan health system at the time. And they said, look, you're not going to be able to be effective in change. And that was the ultimate example of saying, okay, I am going to embrace what might be complete failure, and that is part of trying it anyway. And so I moved. I didn't really know anybody. Fortunately, I did have an aunt who lived there, and so I had at least some personal connection to moving to Edmonton. But everything else was starting from scratch. And I failed abysmally in my first 6 months. I was trying to figure out the system. It was so completely different from a system that I had worked in before. I was not a clinician by training, and primarily I was working with clinicians. But through that, I also learned some core strengths of mine, that by not being a clinician, I could understand a system very differently from the way that they were seeing that system, and that I was very comfortable living in the gray, while most people were really not comfortable with that. And so that allowed me to eventually chart a course through where I was in the Alberta health system that allowed me to input into, and we co-designed a primary care plan for all of Alberta, which I never would have considered to be an area that I would have gotten into. But I had to have a really, really many difficult conversations for the first 6 months to a year that I was there, where I was just constantly being told that I was not achieving the things that I needed to achieve as part of the system changes that were needed.
I can only imagine what that was like. And something that you touched on that I want to double click into is you said, okay, I can view how my difference in experience could actually be beneficial to this situation and make a positive change and impact versus the other way where it's like, well, I am the minority, therefore I can't really make any changes. So how does the role of intersectionality and everything play into that thought process and actually help you navigate some of those gray areas then?
You put that better than I could. Thank you. You're right. It was looking at the differences and valuing those differences. So I think, again, it goes back to the core philosophy of how I work and how I tend to look at my leadership and collaboration with others. And there is a lot to often reflect on as a woman, as a mother, as someone who is of color, and to sometimes you could look at it and go, look at all these systemic barriers that exist. And I'm set up for failure. This is just not going to be something that I'm going to be, my experience is not going to be valued in. And often I've looked at that and said, but these are systems. Again, I say it over and over again. These are systems created by humans. They're created by people, which means that they are systems that we can change because we created them. And sometimes it is very easy to get, caught up in this is the box, this is the regulation, and this is the rule, and not to question why that exists and what outcome that is there for. And the same goes for barriers that might exist as a woman or as a person of color. I look at that and I go, well, here's something that I can work within, but here's something that I can change because I know it's a policy that was created without necessarily any foresight for someone like me who is going to be in this system. And you almost rewrite your role and the outcomes based on recognizing that. I often have to balance, here's what the position is and that is needed, and I can do these things. But also, here are the things that I need to rewrite for or revise for my role in order to adjust for the scope and the skill sets that I bring. And I do that for myself, and we've often done that for team members that we've hired, because again, it's recognizing that experience, their lived experience, and who they are is a huge asset to the role, as opposed to, well, it's not really fitting the box that we were hoping they would fit in.
That is so powerful. And I want to tie that into the work that you're doing through the Brain Well Institute. As CEO, what do you see as one of the most pressing challenges that are facing our dementia care systems today, and how can healthcare leaders address them?
So we just recently completed a study where we looked at internationally all of the countries in the world that have national dementia strategies. So there's a reason why dementia strategies are powerful in a country. And the Alzheimer's Disease International and WHO advocate for countries to develop strategies because it sort of helps focus your vision and recognize the scope of the problem. So Canada has a national dementia strategy that was released in 2019. It's an excellent strategy. It really highlights the key areas that we need to focus on, the principles that underpin all of it that align with our Canadian values. What the strategy is missing is a way in which we can see how we implement it. So just like any good operational system, you need some targets. You need data to know whether you're meeting those targets. What are the KPIs? Who is resourced to be able to achieve these things? And we lack that. So as part of the international strategy, we said, well, what are the ingredients of success that other countries have been able to achieve with moving their implementation forward for dementia? And the key piece here is dementia care. We can and should invest in research. We need to raise more awareness. Stigma around this disease, like dementia, is a progressive disorder. You eventually lose your ability not only to remember core things, but also to be able to function on a day-to-day basis. But what people don't always understand is that you can live for, on average, 8 years with dementia, sometimes far more, sometimes less, depending on the type of dementia. But also, you die from dementia. This is a life-ending disease. And that means that the day-to-day care is crucial when you're living with dementia. And this is really where our system is completely fragmented. On average, it takes about 21 to 28 months to be diagnosed. So almost 2 years to be diagnosed. That's just the diagnosis. And then there's all of the follow-up pieces around follow-up appointments, sometimes no appointments for 9 months to a year. After that first diagnosis, can you imagine being told you have this disease and then not having any follow-ups that would really support how your care and trajectory might look? We don't think about rehab care for dementia. We don't think about how do we support the person's quality of life. From a systems level, I mean. And so we're doing a huge disservice to people who are living with this disease. And eventually, you have caregivers who are burning out. It's an enormous economic cost. It's costing us billions in the health system, both directly but also indirectly. And again, coming back to being a woman and a person of color, it is primarily women who are caregivers. So they start stepping away from their careers and their roles because their caregiving responsibilities can go up to 40 hours a week. You also have primarily women of color who are providing formal care within the health system. They're not really being trained and supported well in being able to do that. So there are all these different pieces that are tied to it. In the international analysis, there were 11 countries that are similar to Canada in terms of our health system. They're decentralized public support systems. And Canada is kind of in the middle to the end of the pack. We don't score very highly, even though our strategy is good, because we don't implement it well. And so at the Brainwell Institute, we have one mission and mandate. It is to get coordinated dementia care into our system. That means you need the federal system to be engaged, to recognize that implementation is needed, but to work and bring partnerships in through all of the provinces, which are where the coordination and the operation of care occurs. And the thing is, know how to do this. We've done this to some extent for cancer care, an enormous disease that impacts people in these huge, significant ways. And I'm not saying the cancer care system is fantastic, but it's certainly far more well-developed and robust than where it was 20 years ago. And at minimum, we are tracking what are called patient-oriented outcomes. So again, going back to KPIs, we have data, we have governance around how and who is operationalizing these things. We have measures that are linked to the financial incentives, and we don't do any of that for dementia. So that's the focus of the Brainwell Institute, is to provide the evidence, but to advocate and move forward that system change at the provincial and at the federal level. And it's a very short mandate in that we don't want the Brainwell Institute to exist into perpetuity. Once this is achieved, and my hope is that we can move this needle forward over the next 5 years, the Brainwell Institute's mandate is done and we can close up shop and move on. But that is really the focus of our work.
I appreciate you walking us through that, because I actually didn't know the extent to which this was impacting folks, right? Because you see only like glimpses and pieces when you have those individuals in your network. But unless if you're a caregiver or you're on the other side supporting these folks, you don't see a lot of these things. And so I'm curious, because you and your team have created multiple platforms for people living with dementia and their care partners to engage in research, advocacy, and really co-designing. So what has been your biggest epiphany or lesson learned from this collaborative approach?
Well, I think the first is, when you think about dementia, most people tend to think of it as an older person's disease, or, something that's not necessarily touching them directly. But 1 in 3 people know someone living with dementia, 1 in 3 Canadians, which means that if you were to speak to anyone, the grocery store clerk, to a nurse that you might encounter, to just a family member or a parent at school, they likely know someone who's living with dementia. So when we come to thinking about co-design, again, it comes back to recognizing what value that lived experience is in being able to think about what the day-to-day needs are. And then the value that we might bring might be more of knowing where the system levers are to be able to leverage the two of those together, the experience and the system levers, to make the change happen. So again, I think it goes back to that same philosophy, right? The experiences that we have are hugely valuable to our professional life, and we try to separate the two and have these completely different spheres. Where we spend most of our time is in our professional lives. And if we're not valuing what people are bringing to the table through their personal lives into the professional, we're losing huge strengths. And so, to your point, we work very closely with people living with lived experience of dementia, caregivers, or living with dementia. But we also work with diverse communities because those communities are not often, their voices are not often at these tables, influencing some of the trajectories and ways in which the system needs to change. And the way we approach it is you as a community have expertise. You recognize and know the cultural needs, you recognize the linguistic needs, and you know how best to support each other. What we bring to the table is an understanding about dementia and about the system. That's our expertise, but it needs to be paired with your expertise. And then we support the community to be able to build that capacity in taking that dementia understanding and then implementing it and using it in their systems and within their communities. And that's where we've really leveraged social media quite significantly to be able to enable that, because the communication through social media has been absolutely phenomenal. And I have learned so much through that process just from others in terms of, how communities see dementia, but also how communities support each other. So for example, we have a partnership with the Indonesian community. And I didn't know until we started again learning and having these conversations with the Indonesian community that many Indonesian Canadians are in Canada and were brought in as formal caregivers. So they were brought in to support people who had dementia or were living with other health conditions to formally care for them. And they were not always told or supported or trained in that process. They might have been trained in Indonesia, but not necessarily within the Canadian system, and did not always feel empowered to be able to share their story or to access the kinds of supports they needed. And there was this one gentleman who shared how he cared for two people who were living with dementia, a husband and a wife, and they were very different personalities because dementia can really impact people's personality and their behavior. And it took him 5 years, and this is not really sleeping, he said, during that time, because both of them would often be up at night and wondering. And so part of his role was to make sure that they were safe, that behavior was actually a form of communication. And it took him a long time to see that, and then to be able to see how to be able to support them so that they would be able to rest more. Because often when they were wondering, it was they were looking for childhood homes or they were looking for their parents, and he didn't know why they were looking or what they were looking for. And it was only afterwards, after he understood that, then he would find, they would have pictures, and then he would be able to sit down with them and talk to them about their parents and sort of help to ease the concern, because they were looking for their parents, and then they would be able to settle a bit more and be able to rest. I mean, and this doesn't always work. There's many other issues and concerns with dementia, but again, I would never have known or understood that, and then understood that the kinds of supports that person needed was more informal caregiving and training, and that was what the Indonesian community might have needed more than other communities.
Something that you shared there that really resonated in terms of even in the corporate system, right? Like, how many times are we putting a Band-Aid solution on something instead of getting to the root cause and actually fixing the system in itself? And I fully admit it's really hard to fix the system and enhance it and move it. And that's why it's easier to just put a Band-Aid. But what you said there was like, if you engage the folks who are actually in it and you listen, you ask questions, that in itself will probably make a bigger difference than sitting up here and then taking a top-down approach with the solution as well. So as we slowly wrap up our conversation, my question to you is, if you could give leaders in a corporate setting or at any setting from that perspective, if you want to influence and create systemic change, understanding that it'll take time and it's a little bit more complex, what is a philosophy or a mindset that you would offer to them?
I mean, I've worked in corporate settings. And I know the pressures of being pulled in a million different directions, having to meet certain goals and meet the needs of other leaders as well in those executive positions or your board, depending on what you're handling and dealing with. But in the past year, I've had the luxury of being able to step back and really focusing in on why am I here and what is it that I want to be able to achieve? That has allowed me to really value the humanity of the folks I work with and the systems that I want to change, and that it is not me that can change it. It really is a coalition of people who move forward. But it takes real resilience to be able to see the longer term goal within the corporate ambitions of the organization. And that was very hard to see when I was in the organizations until I was able to step back. And then when I moved into another one to really keep at the forefront the reasons for why I wanted to work here and what I wanted to achieve at a systems level, the listening is constant. The listening is ongoing and it is evolving because sometimes it feels a little bit like whack-a-mole. You fix one problem and then another problem and then that problem and then another. And you're like, but why? But often those can be rooted down to a bigger systems issue that hasn't been dealt with, that comes down to culture and purpose for your team and for individuals that then contribute to the broader goals of where you're going to go. And I often will try to listen for that purpose with my team and try to align that as best as I can with the broader goals that we're trying to achieve. And that comes purpose, that is what drives us, but that purpose is driven from a passion and from a human value that you have to be able to listen to and see. So that's what I would recommend for my own experiences, at least.
That humanity piece is something that just gave me the chills because I'm like, it's so true, right? Especially as technology evolves and things like you have to keep the human in mind so that you can work through things in a very empathetic way because you have a multi-generational workforce where you don't know how it's going to impact each one and how they're going to actually create value for you in the process as well. It's very much like you said, it's a collaborative
A
process.
symbiosis, really.
Exactly. Thank
Yeah.
you. You summed it up for me really well. And my second last question to you is, what do you think it takes to unleash the potential of individuals and organizations?
I think that as we evolve in our technological use, we evolve in more and more, artificial intelligence, it's going to become an extension of how we work and play and function on a day-to-day basis. And I don't think that we can continue to put the brakes on it and say, okay, we're just not going to use it or we're going to limit it in this way. That has never worked with technology. But again, I'd say that to unleash the potential that anyone has and any team has, you have to have clarity on what outcome you are trying to work towards collectively and have to have aligned purpose with all of the evolving technology. So the way we try to look at it is AI is an extension of how we're going to be working. We all work like that. We all work remotely on our teams. We all use AI liberally in our work. But again, it is recognizing what is the outcome that we are looking to achieve, knowing that as a human, there's going to be key values that you bring that AI cannot bring, at least not yet. And how are you leveraging that and molding that with where you need to go for the systems that we are trying to change, and that those systems are human systems, which means that all of us have a purpose in what that system change is going to be. And that has been the single most effective way in which we have been able to unleash the leaders within and the passion within when you see where your purpose aligns with the overarching goals of where your organization is trying to go.
I'm excited by that because, like you said, it's an extension of what we do, and we can't keep putting a pause in it, even though I think a lot of organizations are, because the behavioral changes take so long, right, to understand that piece. So my last question to you then is, what's one thing that is top of mind for you right now, whether it's a project, initiative, or idea that you're excited about looking forward? And then how can our audience support or learn more about it in that sense?
It's coordination of dementia care. It's the first thing I think about when I wake up and probably the last thing I think about as I go to bed, which is we have this health system that we're proud of. We have federal engagement and we have provincial engagement, but we do not hear enough from people living with this disease. And we are those voices, and we are the most powerful force that we can harness towards that system change. And we've got many different pieces in the fire, whether it's the report that I mentioned that's coming up, the engagement that we have with the federal government and the provincial governments, and the engagements with communities, but they all lead to that coordination of care that has to happen for better outcomes overall for all of us. And it means, again, having to see something bigger than yourself. And that can be hard for folks. And it's hard when you're in the day-to-day of trying to keep up with your everyday mandates and try to, keep up with your personal life. But that bigger than yourself is the purpose that drives us, because we're not going to take any of these things with us when we pass away eventually. And so what are you going to be able to leave and be proud of? And what is the thing that you don't want to regret at the end of the day? And that's how I try to shape most of my days, so that if I were to have to move on today, am I going to have any significant regrets about how I conducted that day? That's how I try to think about it.
Well, I appreciate you sharing your thoughts and your insights and all the impactful works that you and your team are doing. Like, a huge kudos, because it's such important work. So, Saskia, thank you again for your time. And to everyone else that's tuned into another episode, thank you for your time and attention. It means more to me than you'll know. And I can't wait to stay in touch with you on my next episode.